We start in Puerto Rico, where 2 new confirmed cases of monkeypox now brings the territory's total infections to 4. And as the Secretary of Health reports, the infections are not linked to each other. Our Francis Felix reports.
The Department of Health confirmed 2 additional cases of monkeypox, bringing the total register in Puerto Rico to 4 cases. We talked with Dr. Fernando Cabanillas about this disease that keeps vigilant the government and citizens.
Health Secretary Carlos Mellado announced in a tweet that the monkeypox surveillance system confirmed 2 cases for orthopox virus, with a total of 4 cases that are not linked to each other and are associated with trips.
If the same thing that is happening in New York happens here, in California, it's actually where they have more cases in the U.S., and it's also spreading fast. So I don't think it's going to become a pandemic like COVID. I don't think that's going to happen because mostly it's not as contagious as COVID, and the people who are infected with monkeypox, they usually don't transmit the disease until they become symptomatic. So it's different in that sense, different to COVID.
What are the symptoms associated with this disease?
Initially starts with a fever, with the very intense headaches, swollen lymph glands, which can be in the groins or in the neck or in the underarms. And then after that, like 3 days later, the patients will develop the skin lesions, which start like spots, flat spots, but then they become protuberant. That's what we call papules in medicine. And then from papules, they can ulcerate and become infected.
But how long the symptoms last?
It takes usually like 2 to 4 weeks for the disease to eventually fade away, but it can kill like 5% of the people that are infected. So the disease is mostly spread by direct contact with skin lesions. It's been mostly, basically almost all of the cases have been in males that have sex with males, so either bisexuals or homosexuals. But of course, that's exactly how AIDS started, exclusively in homosexuals, but eventually it spread to heterosexuals.
Cabanillas explained that it's not contagious as COVID, and people who are infected don't transmit the disease until they become symptomatic.
Isolate people because if they become symptomatic and they have skin lesions, and if people are aware about this, like I think a lot of people are becoming aware of this, then they should self-isolate and they should seek help from a physician because they have to diagnose it. There's not a blood test to diagnose the disorder. You have to scrape the lesions, and then that's done by the Department of Health.
According to the World Health Organization, 1 case of monkeypox in a non-endemic country is considered an outbreak. The doctor assures us that more cases of monkeypox could spread in the island. Reporting from San Juan, Puerto Rico, Francis Felix.
All right, thanks so much, Francis. In the meantime, more than 20 migrants from Cuba came ashore early Tuesday morning near a marina in Key Biscayne, Florida. U.S. Border Patrol officials confirmed 25 migrants came ashore about 5 a.m. During the maritime smuggling event. There were 17 men, 6 women, and 2 accompanied children in the group. The migrants came from Cuba with 1 man saying he has family in Miami. All of the migrants were taken into federal custody. And meantime, maternity leave for government workers in Jamaica is about to increase from 40 days to 3 months. Paternity leave and special leave for adoptive parents are also on the cards. Those announcements were made by Minister of Finance and the Public Service, Dr. Nigel Clark, who told a press conference on Tuesday that the government is moving to implement changes to family leave for public sector workers. He said the changes are part of government's move to modernize the public service.
The government of Jamaica intends to update the Public Service Staff Orders of 2004 to increase maternity leave from 40 days to 3 calendar months. The government of Jamaica also intends to update the Public Service Staff Orders of 2004 to introduce paternity leave for the first time in the public service for fathers of newborns for a specific time and under specific terms to be finalized. The government of Jamaica also intends to update the public service staff orders of 2004 to introduce family leave for adoptive parents who are bringing a new child into the home.
Now, Minister Clark went on to say the appropriate circular to give effect to the changes will be sent to members of the public service by September 30th. Well, meantime, the pandemic has brought about a significant increase in vision complaints, partially from spending more time than ever staring at screens. Some could find a solution in the new innovation in vision correction that implements contact lenses onto your eyes. Danya Backus shows us how they all work from New York.
All right, let's take a look.
Powell Robinson has used corrective lenses since first grade. Now working as a cinematographer and director, his contacts had become a constant misery.
The inflammation from wearing them for super long hours was making my vision get a little blurry, my eyes would get super dry, and it was just getting sort of unsustainable.
To help correct his vision and ditch his contact lenses, his eye doctor suggested a procedure known as Evo Vision ICL.
The Evo ICL is a permanent implantable contact lens that's placed in the eye instead of a contact lens that you would wear on the surface of the eye where you have to constantly take out and put back in.
Dr. Netta Shammy is an ophthalmologist with the Maloney Shammy Vision Institute. She says the procedure is ideal for treating myopia, otherwise known as nearsightedness, and offers an alternative to LASIK surgery, which works by changing the anatomy of the eye.
The Evo Vision ICL procedure has been approved overseas for 10 years, with more than 1 million surgeries performed. Here in the United States, it was approved by the FDA in late March.
It hits the market just as eye complaints are soaring. Myopia is increasing so rapidly, an international study estimates half the global population could be nearsighted in the next 30 years.
This is the best you could see without your glasses and contact lenses prior to surgery.
The implants take just 8 to 10 minutes per eye, and the improvement is nearly immediate.
It's pretty weird to wake up in the morning and just see.
A new window on the world, which Robinson describes as life-changing.
Now, the procedure costs anywhere between $2,500 and $5,000 an eye because it's an elective surgery and it's generally not covered by health insurance.